Okay, let's go back here. This is week 2, lecture 1, or the third total lecture of skin disorders. Now, barbers perform facials and shaves and need to be able to recognize different hypertrophy, such as moles or warts, and skin conditions that may be aggravated by these procedures. Symptoms represents a sign of disease. Subjective symptoms are symptoms that can be felt by the individual. Objective symptoms are symptoms that can be observed. We discussed this in level 1. You need to be able to differentiate between your non-contagious and contagious skin conditions. Some skin or scalp disorders may be treated in cooperation with a physician or dermatologist. Barbers should not perform services on persons with infectious skin disorders or inflamed skin. Okay, lesions. A lesion is a mark on the skin that may indicate an injury or damage that changes the structure of tissues or organs. A lesion can be as simple as a freckle or as dangerous as skin cancer. Lesions can indicate skin disorders or diseases and may be symptomatic or of other internal diseases. Being familiar with the principal skin lesions will help you to distinguish between conditions that may be compatible with services and those that need to be referred to a physician prior to the provision of service. Okay, you got primary and secondary skin lesions. Now, your book from pages 230 to 233 has graphics and images and description and examples of different types of lesions. Please refer to these so you can get a clear picture of what they look like. I'm going to go over a few. A primary lesion, let's go here. Primary skin lesions, they are lesions that are of a different color than the color of the skin, or lesions raised above the surface of the skin. Table 9.1 lists some primary lesions. I'm going to give you a few. Bulla, a large blister containing a watery fluid. Cyst, or tubercle, is closed. It's an abnormally developed sac that contains pus, semi-fluid, or morbid matter above or below the skin. Macule, it's a flat spot or discoloration of the skin that's like a freckle or liver spot. Nodule, solid bump larger than 4/10 of an inch that can be easily felt. That's examples of swollen lymph nodes. Papule, small elevation on the skin that contains no fluid but may develop pus. Example of a papule are acne, warts, or elevated nevi. Pustule. What is a pustule? Raised inflamed papule with a white or yellow center containing pus in the top section. Examples of pustule are also acne, folliculitis, or impetigo. Pustule. Oh, we talked about that. I'm sorry. Tumor. Abnormal mass varying in size, shape, and color. Any type of abnormal mass, not always cancer. This requires medical referral. An example is cancer. Vesicle. Small blister or sac containing clear fluid. And wheal. An itchy, swollen lesion that can be caused by a blow, scratch, bite of an insect, or urticaria, which is a skin allergy. Examples are hives and mosquito bites. So as a barber, you want to be able to identify those types of primary lesions. Please refer to your chart, table 9.1, I think on page 231 in your book. Okay. Secondary lesions is an accumulation of material on the skin surface, such as a crust or scab, or by the depressions in the skin surface, such as an ulcer. Different types of secondary lesions are as follows. Crust, dead cells, that's like a scab or a sore. Excoriation, skin sore or abrasion produced by scraping or scratching. That's a nail cuticle damage from nail biting. A fissure, cracking the skin that penetrates the dermis. Keloid, a thick scar resulting from excessive growth or fibrous tissue that will form along any type of scar for people susceptible to these. Scale, thin, dry, oily plate of epidermal flakes. Examples are excessive dandruff or psoriasis. Scars, okay, you probably had a stitch or some type of procedure. You needed operation on it. We know what a scar is. Ulcer, open lesion on the skin or mucous membrane on the body, accompanied by a loss of skin depth and possibly weeping of fluids or pus. Examples are herpes and chickenpox. So please familiarize yourself with the disorders, those primary and those secondary lesions. And although we as barbers cannot treat those, it's great for us to be able to identify it, because sometimes, especially in the cancer causing, you usually start with a small form of cancer and it can grow into more. But if we identify it early, we can probably save lives. Okay, disorders of the sebaceous glands. Open comedo, which is also called a blackhead, that we talked earlier, hair follicle filled with keratin and sebum. A closed comedo, which is whitehead. That's a small bump just under the skin surface. Milia is benign. Benign means harmless. It's keratin-filled cysts that appear just under the epidermis and have no visible opening. Acne, chronic, it's also called acne vulgaris. It's a skin disorder characterized by chronic inflammation of the sebaceous glands from retained secretions. You got different grades of acne, from grades 1, 2, 3, and 4. Acne is synonymous with puberty or just maybe improper care of the skin. But when you're dealing with acne, you can identify it. You can recommend facial treatments, but also refer to a dermatologist to help fix the situation. Sebaceous cyst is a large protruding pocket-like lesion filled with sebum. Seborrheic dermatitis is an inflammation of sebaceous glands. It's redness, dry or oily scaling, crusting, and itchiness. Dandruff and cradle cap are forms of seborrheic dermatitis that are sometimes treated with topical creams. Okay. Rosacea is also used to be called acne rosacea. It's a chronic condition that appears primarily on the cheeks and nose, rosy cheeks. It's categorized by flushing, telangiectasis, and in some cases, the formation of papules and pustules. The cause of rosacea is unknown, but the condition is thought to be genetic. It can come from exposure to heat, sun, and very cold weather, ingestion of spicy foods, caffeine and alcohol, and stress. If a client has rosacea, refer them to a physician. Osteotosis is dry, scaly skin, absolute or partial sebum deficiency. It can be a result of old age, exposure to cold or alkalis, or bodily disorders. Steatoma. Steatoma is in a sebaceous cyst or fatty tumor that is filled with sebum. It is a subcutaneous tumor of the sebaceous glands that can range in size from a pea to an orange. A steatoma usually occurs on the scalp, neck, or back, and is sometimes called a wen. Okay. Acne treatment. Let's go here. Okay. Right here. Oh, sorry. Okay. Let's go. Okay, sorry. All right. That's us. Now we got to talk about some disorders of the pseudophorus glands. Pseudophorus glands are your sweat glands. Anhydrosis. Anhydrosis represents a deficiency in perspiration or the inability to sweat, often a result of damage to the autonomic nerves. Bromhidrosis is foul-smelling perspiration. That's either your armpits or your feet. It's generally caused by bacteria. This requires medical attention. Hyperhidrosis is excessive sweating. That's either caused by heat or general body weakness. And miliaria rubra is prickly heat. It's an acute inflammatory disorder of the sweat glands, characterized by the eruption of small red vesicles accompanied by burning, itching skin. It is caused by exposure to excessive heat and usually clears in a short time without treatment. Okay. Some other inflammations and infections of the skin. Dermatitis is the general term for an inflammatory condition of the skin. The lesions may appear in various forms, such as vesicles or papules. Irritant contact dermatitis is abbreviated ICD. It occurs when irritating surfaces temporarily damage the epidermis. Eczema is an inflammatory skin disease that may be acute or chronic in nature and present in many forms of dry or moist lesions. Eczema is frequently accompanied by itching or burning. In all cases, should be referred to a physician for treatment. Eczema is not contagious and its cause is unknown. Psoriasis is a chronic inflammatory skin disease characterized by dry red patches covered with coarse silvery scales. Psoriasis usually occurs on the scalp, elbows, knees, chest, or lower back, but rarely on the face. If irritated, bleeding points can occur. It is not contagious and its cause is unknown. Herpes simplex 1 is a recurrent viral infection that produces fever blisters or cold sores, categorized by a single vesicle or group of vesicles with red swollen bases. IV dermatitis is caused by the exposure to poison ivy, poison oak, or poison sumac leaves. These disorders are serious, and you want to make sure that you receive medical attention if you come into contact with these.